biggest factors to consider when thinking about whether to get the vaccine if you are pregnant or breastfeeding are your risk for infection as compared to your risk if you catch the disease. So we know, for instance, that pregnant women, if they are infected with COVID-19, while their absolute risk of becoming very sick or being hospitalized is low, just like anyone, right? Only a small percentage of people that catch the disease will be hospitalized. We know that pregnant women do have somewhere on the order of a threefold higher risk of, for instance, severe disease requiring ICU admission, and nearly double the risk of someone who's not pregnant of dying from the disease. Those increased risks are compounded by any other comorbidities, whether it is obesity, diabetes, gestational diabetes. We also know that women of color are disproportionately affected by COVID-19 and have a disproportionately higher risk of hospitalization or death. And so then we compare that to the very low or non-existent theoretical risks of the vaccine itself based on the mechanism of how the vaccine works, and then the risk of being exposed at all. So for instance, if I had a patient who was working from home, virtually never leaving the house, her partner was doing the grocery shopping, I might say to her, well, you seem to have a very low risk of exposure, so you might consider not getting the vaccine if you're worried about potential side effects. Versus, I have patients who are themselves nurses, physicians, physical therapists, people in healthcare who see patients and have a very high risk of exposure. And to those patients, I would say, I agree with the recommendations from all of our governing societies that your risk of exposure is high. So I would recommend vaccination in those cases. I have not seen any evidence indicating that you should delay vaccination, and all of our governing societies agree that vaccination should be offered to lactating women. I see it from a perspective of, the risk of pregnancy versus the risk of breastfeeding, or the risk when pregnant versus breastfeeding. When breastfeeding, certain types of antibodies can cross into breast milk. But we have no evidence whatsoever that either the mRNA from the vaccine nor the spike proteins that the mRNA codes for can cross into breast milk. And there's a possibility that some of those antibodies that the mother's body makes could potentially cross into breast milk and help protect a baby. That's theoretical. We don't know that yet, but it's similar to how the antibodies that are produced when a pregnant woman gets the Tdap vaccine, the vaccine for tetanus, diphtheria, and pertussis. Some of those antibodies can cross the placenta to help provide protection for a baby, and then can continue to cross into breast milk when breastfeeding. So I would absolutely recommend that if a woman is lactating and meets inclusion criteria for vaccination, that she should consider getting it. The most telling recommendation when considering whether or not to delay vaccination based on whether or not you're trying to conceive or undergoing fertility treatment comes from the American Society of Reproductive Medicine. So these are the reproductive endocrinologists who treat infertility and deal with infertility issues all day, every day. They do not recommend delaying fertility, whether it's delaying conception or fertility treatment, because of vaccination, and they don't recommend delaying vaccination if one is trying to conceive. That's true for both the ASRM, which mainly deals with female infertility, and the society that governs or treats male infertility. That's the Society for Male Reproduction and Urology. Both of those societies agree that for men and women, they should be offered those vaccinations regardless of their attempts to conceive. There is no reason to delay vaccination to await a pregnancy test. Again, we think based on how the vaccine works, it's a mechanism of action, we have no reason to suspect that it could cause problems with pregnancy, even in early pregnancy. Now with the second dose, it is fairly common to have a low-grade fever. And there's some evidence that fever in early pregnancy could potentially have a slightly increased risk of certain types of problems in pregnancy. But again, when compared to the risk of catching COVID, we think that the risk of vaccination in pregnancy is lower than the risk of the disease itself. There were some news stories recently questioning whether or not vaccination could impact male fertility. And based on all of the data that we have, there's no reason to suspect that it would impact long-term male fertility in any way. Now, again, we know that the second dose of vaccine often causes a low-grade fever, and a fever can temporarily reduce sperm counts in men. Those sperm counts generally rebound very quickly, and it is probably less severe than the decrease in sperm count that one would experience from symptomatic COVID disease. So for both men and women, there's no reason to believe that it would affect fertility in any way. And in fact, in the trials where there were women who were inadvertently included in the trials because they didn't know they were pregnant yet, those women did not have increased rates of bad outcomes. And there were women who were trying to conceive. And so the women who got the vaccines did not have a different rate of conception than the women who didn't get the vaccine. So that's very encouraging for both male and female fertility. Questions about whether or not the vaccine could affect the placenta, and that mainly relates to the fact that the spike protein that is encoded by the mRNA vaccine shares certain small portions of that genetic code or of that protein sequence with a particular protein that occurs on the placenta. However, those areas of overlap are very, very small, and so we have no reason at all to suspect that the vaccine could cause a weakening of the placenta or cause the immune system to attack the placenta. And I think that will be borne out as we get more data about the vaccine in pregnancy. But based on the limited data that we have so far, we didn't see any differences in things like miscarriage or pregnancy loss in those women who were vaccinated when they did not know yet that they were pregnant.